Hi, my name is Karen. I am a nurse practitioner with Express Care Online. Today, I'm going to walk you through on how to complete an eVisit. eVisits are completed via MyChart by the patient, and that is then directed to a pool. This is going to give you steps on how to complete it efficiently and timely. First, you want to access My Practice. Using your user ID and password, you're going to log in. Before logging in, you want to select the correct department. We are going to be using Urgent Care Distance Health. Once you selected that, hit Accept and then Continue. From there, you can see your platform. Now to add the in-basket pool for which you are going to be viewing patients for eVisits, you're first going to go to Epic. From Epic, you're going to go down to Tools, and from Tools, you're going to go to Patient Care Tools. From there, you are going to find the in-basket class. Now, as you can see, I am already listed in two different pools. The one that is the most important one to focus on and that we will be going over today is the MYC, the MyChart Express Care eVisit Team Pool. Easier way to find it is using the number 300789. Once you select that, hit Accept. And from there, you are good then to start viewing eVisits. Now to find that, you're going to go into your in-basket, which is on the top left portion of the screen. You can find that little envelope. Here, you'll find that under your My Messages, eVisits. As you can see, there are 7 eVisits that have yet to be done. Now, before we start going into eVisits, I want you to understand that there are several different eVisits that are being accessed into this pool. We have Adult Express Care, we have Adult COVID-19 screening, we have Pediatric COVID-19 screening, and then we also have Pediatric Express Care eVisits. Occasionally, there will be other departments that their eVisits do come to our pool in error, and that will be then sent over to the correct pool, but that is from a specific team that is managing that. So you do not have to worry about that at this time. So what we are focusing on today is going to be the Adult Express Care eVisit, Adult COVID-19 screening, and the Pediatric COVID-19 screening. Now, to sort that, to make it easier for you to view, you are going to first then go up to Sort and Filter. From Sort and Filter, you're going to go down to Advanced. From Advanced, you are going to hit Subject, Add, and then Accept. Now it is going to prioritize the eVisits that you want to see. There are a lot of providers that have access to this pool. To best determine if a provider is in the pool, you can do so in the top left corner of the eVisit. As you can see, there is a question mark. Once you click on that question mark, that means that you are taking the baton, meaning you have taken over for this eVisit. There are times where you might see a dash. The dash means that there is already a member of the team that has taken over this. If this might be confusing to you, it's always best to determine if a provider is already in the visit. And by doing that, you can click on the patient and hit Review. That will then bring you to Chart Review. And if their name is in there, as you can see my name, that means the provider has already initiated the eVisit. What I do suggest is just exiting out of the eVisit and moving on to the next one. Now, there are some eVisits that are grayed out and some of them are in bold. When a provider has already initiated or viewed the eVisit, that will then gray out the eVisit. If you do select an eVisit and you did it in error, say it was a pediatric eVisit that you are not covering, all you have to do is hit Mark as New, and then that will then make it bold again for a provider to go into the eVisit and complete it. So let's go into this one. So this is a patient that had completed an eVisit. As you can see, the subject, it's an Adult Express Care Urgent Care problem. To view it, before actually entering the chart, you can see on the right-hand side of the screen, allergies, pharmacy, medications, and the questionnaire are all visible. That is one way of viewing the eVisit. And once you have reviewed it, You can then now enter the eVisit. Two different ways of doing it. You can double click on the eVisit, just on the patient's name, or on the top right-hand portion of the screen, you can hit eVisit Encounter. This will then pull you into the patient. I always suggest to providers is select chart review before doing anything. The reason why I say this is a patient could have recently completed an eVisit and or been seen recently. eVisits are supposed to be simple visits, meaning if the patient was recently treated for an illness or has an extensive medical history that is not appropriate for treating an eVisit, they should be referred. So it's always best to review the chart to see if a patient was recently treated, recently completed an eVisit, and that from there you can determine if you're able to treat then the patient. Now to go back to the eVisit questionnaire, you can hit eVisit Intake on the top portion of the screen. This again will pull everything that you will need. Questionnaire, you can view again. This, as you can see, is an adult COVID-19 screening, and the patient must be in Ohio to complete an eVisit. Anybody out of the state of Ohio will get a hard stop. We are unable to complete anything out of Ohio due to legality reasons. So the patient must be in the state of Ohio. Once you review the questionnaire and deem if it is appropriate to treat the patient, now you can go further in assisting. There are 5 adult eVisits. Those include low back pain, sinus symptoms, UTI, vaginal yeast infection, only for women. The eVisits are set up to correlate with what is existing for the care path and the guidelines for telemedicine or express care online. Once you determine if the patient can be seen and treated, review the pharmacy. Pharmacy is listed on the bottom screen. To add an order, you can do so on the bottom left-hand portion of the screen. Select the medications that you would like, or you can search for them. Accept. If you need to verify the pharmacy again, you can click on Preferred Pharmacy. It will show up on the bottom portion of the screen. And as you can see, this is consistent with what is already with the patient's selection. If you have not already done so, you can add your diagnosis. For this, as we're just treating an easy, simple sinus problem, and we're not typically actually talking with the patient, you can put either sinus problems, sinus infection, sinusitis, anything is deemed appropriate. Associate it with your diagnosis, hit accept, and of course, this doesn't differ from any standard practice. You always want to check interactions and then hit sign orders. Once you have completed your orders, you can then complete the progress note. If you're using a widescreen, your progress note is going to show on the right-hand portion of the screen. Hit progress note and add your note that you would like. Accept. Now you have your progress note. This is important. It is that you always add a progress note. Again, this is documenting what you're doing and what you're treating for the patient. Before you can close out the encounter, the last step, one of the last steps that you're going to be able to do is the My Chart message. Now you can see that there's 2 different options. There's a new message here, or there is a reply. Do not hit new message, because then when you're trying to close the encounter, it's going to tell you that you did not reply to the patient. So please make sure you always hit reply to the patient. You always want to hit do not allow patient reply. We do not want to receive patient messages back to the in-basket. They are not to be messaging us back, and we are not to be messaging the patient with any questions in regards to the eVisit questionnaire. If you have an eVisit question that is concerning regarding the questionnaire, that will determine that it is not appropriate for an eVisit. eVisits are simple visits. If you have any questions or concerns on the patient's health, or if they need further workup, that is deemed not appropriate for an eVisit. So when messaging the patient, please always make sure do not allow patient to reply. Now you can add your message of what you would like to send the patient. There are dot phrases that you can utilize, and if you'd like access to that, please reach out to your quality leadership, and we can provide you with those too as well. But you can reply to the patient, and basically it's just giving them an idea of what you're treating them for. You can list the medication below and add any education that you would like as well. Once it looks appropriate to you, hit accept. And again, I always reiterate, make sure that box is selected, do not allow patient reply. Hit accept and send, and that will send it to the patient. Once you followed all those steps, you are now good to complete the eVisit and sign the visit. Thank you for watching this video on how to complete an eVisit.